Good afternoon and welcome to today's webinar on supporting international employees. My name is Iain Spink. I'm HCPC Professional Liaison Consultant for England, and this webinar has been designed for those who manage, lead or employ HCP registrants, and we can see from the sign-up details that we've got a wide range of different managers and covering all the professions that we regulate in terms of who you manage, so that's really terrific. Thank you for being with us. And the focus of today's session is how to support international registrants in your teams, from recruitment to integration through to day-to-day work and practice, using the principles for preceptorship, a set of practices that have been proven to increase staff retention. And thank you to those who submitted questions before the session. We have read them all, and most will be addressed in the session, and the answers to others can be found on the HCPC website. So, for example, those questions related to registration and or HCPC processes. So why is this an important topic? So the NHS from its inception in 1948 has relied on and benefited from the skills, knowledge and experience of international healthcare professionals. The HCPC international route is one of our key paths to registration, open to those who trained or studied outside the UK. And to give a sense of scale, over the past 2 years, we've received over 13,000 applications through it. But we know, however, that transition to UK practice is not always seamless for our international registrants. And preceptorship principles and the implementation of a considered programme of support can help with this transition. So if you lead, manage or employ international staff, the support you provide can determine whether they thrive in their role. And whilst the focus of today is on preceptorship, we acknowledge that many international professionals who are newly registered with the HCPC are not necessarily newly qualified in their profession. Many are experienced practitioners, so whilst they will not be new to their profession, they will be new to the customs and practices of UK healthcare. So a considered and informed preceptorship programme can help with integration and transition. I will share some examples today of how organisations have approached this via preceptorship programmes and other initiatives of support and professional development. We also acknowledge that there has been a recent shift in focus from the UK government regarding international recruitment. In the recent government policy paper, Fit for the Future 10-Year Health Plan for England, the intention is stated, and I quote, to reorientate the focus of NHS recruitment away from its dependency on international recruitment and towards its own communities to ensure sustainability in an era of global healthcare workforce shortages, and an ambition to reduce international recruitment to less than 10% by 2035. So we are aware that for many NHS organisations across the UK, active international recruitment has slowed down. There may also be a shift towards recruiting international registrants who are already in the UK. However, retention and development of existing staff is crucial to maintaining high standards of patient care and treatment, and we are still seeing international applicants to our register. So in today's session, in addition to preceptorship, we will also look at how you can continue to provide support and professional development for your international registrants. We will also look at the challenges that may be faced by the international workforce and what we can learn from the approaches and initiatives of other healthcare regulators and professional bodies. We will be looking together at these insights and highlighting any resources that can help, whilst keeping in mind the principles for preceptorship. And I'm delighted to say that today we are also joined by Mobolaji Lewis. Mobolaji is Chief Allied Health Professional at Essex Partnership University NHS Foundation Trust, and we will be having a conversation together later in the session around this topic. A little bit of housekeeping. So there is a Q&A function available on Teams during the session for questions relating to the topic, and we have colleagues who can answer those in the background. If we don't get around to your question, please do connect with us after the session and we will come back to you. There will also be a short survey at the end of the session. And finally, you will receive an email with a copy of the slides and a recording of today's session in the coming days. So here's an overview of today. Why focus on preceptorship for international registrants? We'll be looking a bit at the history and context of international recruitment in the UK, health service and current climate. We'll be considering the benefits of preceptorship and highlighting the HCPC standards that it relates to. Thirdly, we'll look at the HCPC principles for preceptorship and the significance for international registrants. Bit of a refresher really on the principles of preceptorship, but with some thoughts as how they can support international registrants. And it's during this section that I will have the conversation with Mobolaji, who will share some of his lived experience, insights and initiatives from his work at Essex Partnership Trust. And then finally, we'll look at how we support international registrants or overseas healthcare staff by sharing some learning from other regulators and professional bodies and signpost to some research and resources around supporting international staff and supporting staff from Black and minority ethnic backgrounds. So in terms of background to this subject, this graphic on the slide offers an overview of the diversity of the NHS workforce. A range of different countries of overseas employees. A lot of the info here is from a recent paper from the National Guardian's Office, which is credited on the slide, and also data from NHS Digital. So since its establishment in 1948, the NHS has relied on a diverse workforce, including overseas trained healthcare professionals. After World War II, the UK experienced a significant influx of healthcare workers from countries such as India, Pakistan, and those in the Caribbean, which helped build and sustain the health service. And over time, international recruitment has continued in response to things like workforce shortages. It's been influenced by factors including immigration policies, global health crises, and rising demand for healthcare services. Overseas trained doctors, nurses, and allied health professionals have been instrumental in addressing workforce gaps, particularly in understaffed specialities and regions with recruitment challenges. So by 2024, 18.7% of NHS workers in England were non-UK nationals. That's 27.2% of nurses, 35% of doctors. These workers represent more than 200 nationalities, with the largest groups coming from India, the Philippines and Nigeria. And in this graphic, the top 102 nationalities are shown out of a total of 216 different nationalities. And the total number of staff is 1.51 million. And NHS digital figures show that as of June 2023, 1 in 5, so just over 20% of NHS staff in England were non-UK nationals, and that's the highest proportion on record. Health and care professionals who trained and qualified outside of the UK are a hugely valuable part of the HCPC register and workforce. As I mentioned earlier, it's one of our key paths to registration. Over the past 2 years, we've received over 13,000 applications through it. As of the 5th of September this year, we had 59,493 international registrants on our registers. That's equivalent to 16%. Radiographers have the largest proportionate share of international registrants of all our professions, and the total number of our registrants is at this point was 364,350. Our data also provides insights into retention rates of our registrants. In 2024, we published an analysis of retention rates among registrants who joined the HCPC register via the international route. It showed that 34.2%, equivalent to just over 1 in 3 of all new international registrants, left the HCPC register within 4 years of joining. Retention rates varied considerably within professions, depending on the age, sex, and country income group of registrants. And the 2 QR codes on the screen, the first one will take you to an article about what the HCPC is doing for international registrants, and the other QR code takes you to our data hub, which is a really good resource there for you. So as we've seen so far, the contribution of the international workforce to the NHS have been of central importance historically and in the present day. Over a third of the doctors registered in the UK gained their primary medical qualification overseas. And the contribution is echoed here in a publication called Welcoming and Valuing International Medical Graduates, a guide to induction recruited for international medical graduates recruited to the NHS. And this document highlights the importance of induction for international registrants. So this information is from the same guide, a guide to induction for international medical graduates. And it pertains to doctors, of course, and the NHS specifically, but it paints a relevant picture, I feel, of the experiences of international recruits to UK healthcare. And it is quite a concerning picture. So it shows a high proportion of this workforce are from ethnic minority backgrounds, and it suggests that many are expected to start work without adequate induction. Substantial evidence showing that ethnic minority staff are likely to experience racism and discrimination and may have poorer experience and progression opportunities. And at the time of this report, induction had already been identified over 10 years previously as a means to reduce the higher risk of international medical graduates being referred for fitness to practice investigations. And it concludes that so far little has changed. So we will be returning to some of these themes during today's session, namely the importance and value of induction and preceptorship programs, which can offer a structured and sustained introduction to the organisation and to UK healthcare practice. And as we can see, a lot of learning and development has been achieved by the nursing and medical professions around preceptorship and ongoing workplace experiences, which can offer useful insights that are of relevance to the challenges faced by our HCPC registered international healthcare professionals. There's a longer history of international recruitment, perhaps of doctors and nurses, and it's more recent for HCPC registered professions. In our most recent HCPC Employer Insights newsletter, we spotlighted international registrants, and the QR code there will take you to the webpage for the full article. But I wanted to share this with you today. Two organisations shared insights into how they recruit and support international registrants and the benefits they bring. So we have examples from Lewisham and Greenwich NHS Trust and Birmingham Community Healthcare NHS Foundation Trust. And Daniel Weston, AHP Workforce and Education Development Lead at Lewisham and Greenwich, shares their approach to supporting internationally trained staff. They have a robust preceptorship package, 12-month period of structured support. This package is also multidisciplinary, which allows for networking across professions, and it includes sessions delivered by the HCPC. They have a Welcome to UK practice course. It covers professional standards, reflective practice, raising concerns, NHS structures and life in the UK. They have an international colleagues network and several supportive staff networks. They have profession-specific development programs, offering opportunities including clinical training and lifelong learning development opportunities across the 4 pillars of practice. And they also have a detailed wellbeing offering that includes a range of sessions and workshops, and also access to psychological support such as counselling if required. And they are evaluating and improving this offer too, and they do that through feedback and following the latest research. And over in Birmingham, Dr. Pameletta Ricketts, who's AHP Professional Lead and HCPC Council Member, shares the considerations that have produced a strong, productive international staff contingent. So that includes pastoral support, that includes acclimatisation, accommodation support and support with practical issues. They have a preparation for practice programme, which includes sessions on understanding the organisation, the NHS, team dynamics, service structure and role. And the HCPC Professional Liaison team, the team that I work within, has inputted into the programme, and they feel this has helped to provide insights to clinicians and managers in relation to standards of practice, professionalism and fitness to practice. I'll say a little bit more about what our team can offer again later in the session. They have a robust induction to local teams and an international recruitment forum, so really good for networking, learning and also celebrating achievements. They have an ongoing commitment to support the continued development of staff via their scheme called Impact, which supports staff looking to progress in their careers. They've developed a Building Bridges initiative to promote an environment where there is greater understanding of cultural identity and promote integration. So we look at things like the cultural barriers and unconscious biases that impact on decision making, and they have transformational ambassadors that support implementation of this programme. So we can see from these two examples that preceptorship or induction can be key parts of how these two organisations have supported their international registrants. But arguably they've gone beyond preceptorship to include programmes of support and development that will promote the continued development and retention of staff. So we will return to this theme of continued support later in the session. But let's now return to the concept of preceptorship and the HCPC principles. So preceptorship is a period of structured support provided to HCPC registrants at key moments of career transition. We'll call those receiving preceptorship the preceptee and those providing the support the preceptor. So it's commonly associated with being offered to newly qualified staff, sometimes for a short period, like first 6 months, for example, but we now recognise preceptorship is needed at any key moment of career transition. Transitions in practice can happen for many reasons. You may be a newly qualified graduate, someone with a significant change in your job role. You could be returning to practice from a career break, or there could be an internationally trained professional and are new to the UK register, which is our focus, of course, today. And we should also consider that preceptorship can also be helpful for international registrants who are already in the UK, who may be having a career transition to your organisation. So why are we interested in preceptorship? We have a statutory role. It's required by law to protect the public. And you can see that's at the heart of what we do, with over 330,000 registrants across 15 different professional groups. We're always seeking to promote high quality professional practice in a number of ways. We're known for our regulatory function, setting the standards, approving programmes, keeping a register of professionals, and then acting if professionals fail to meet the standards. But the best protection is always preventative rather than reactive. So we use our data and learning increasingly to look at the contributing factors that can lead to patient harm and do what we can to reduce these. So when we look at the benefits of preceptorship, we can see that the building up of confidence is a key role. Confidence in both clinical and non-clinical aspects of a registrant's work, promoting engagement, not just with the role, but with social cohesion within the team. And that's really important aspects for international registrants who may be new to UK healthcare or those transitioning to a new service or role. Staff who feel welcomed and valued, who feel they have a role here because someone took time to make sure they understood that role and helped with their transition into the service or the organisation, are probably more likely to stay. So it can really help with retention as well. We've also heard how preceptorship can provide a safe space for the disclosure of both positive and difficult information. So if concerns arise, they can be escalated promptly. So it's vital that to keep staff and patients safe, there must be opportunities for staff to raise concerns and learn how to go about that. And international registrants will be adjusting to working in UK healthcare and also to life in the UK with significant differences in workplace culture. So if any concerns arise for the registrants, the access to support and supportive connections that preceptorship can provide could be really helpful. The preceptorship programme is also the perfect opportunity to set the tone or culture in a department right from the beginning. Many preceptorship programmes also use it as a time to discuss the preceptee's career development plans, again demonstrating genuine interest in those who are new to the team, which again can link in with retention. But also benefits the career development of the preceptor, because the preceptor will have the opportunity to develop things like leadership, teaching, mentoring, coaching skills, collaborative working as well with other professionals. So international registrants will have much to offer. They will bring different perspectives and insights into the workplace culture, which could be important to learn from in shaping the culture and improving areas such as inclusivity and fairness. And finally, it's a great opportunity to empower our preceptees by asking them to share fresh ideas and changes they can bring from previous experience. International registrants may be new to our register, but are usually not new to practicing their profession, so they bring a wealth of experience and knowledge. And we must then, as employers, be open to the new ideas they bring. Something you could see is coming under the category perhaps of reverse mentorship. And Staff could really benefit from hearing from our international registrants to learn from and improve understanding and awareness of their experiences. Preceptorship could be a place where this starts. So we'll see later some initiatives around improving cultural awareness and support for international registrants that can help with retention and career progression. And of course, all of these benefits, we would argue, link in really well with our HCPC objectives around public protection. So preceptorship is also a way of meeting some of our standards. So our registrants, we feel, appreciate reassurance that they are meeting the standards. So I wanted to highlight some examples of how preceptorship relates to our standards. As you know, we have three key sets of standards for registrants. Standards of conduct, performance and ethics, shown here, which provide registrants with behaviours expected of them. The HCPC does not mandate preceptorship specifically, but we do state that registrants must seek feedback and use it to improve practice. Also work in partnership with colleagues, sharing your skills, knowledge and experience where appropriate. Preceptorship gives you an opportunity to meet this standard, either as a preceptee or a preceptor. Then we have standards of proficiency for each professional group. Of course, they set the clear expectations around knowledge and skills required to practice. So there's a number of points we could have pulled out here that could relate to preceptorship, but here are a few. 4.8 is about understanding the need for active participation in training and supervision, professional conduct, and demonstrating that in practice. 8.11 is around promoting, engaging, and learning of others. 10.1, understand the value of reflective practice and the need to record the outcome of this kind of reflection. 14.2, demonstrate awareness of relevant health and safety legislation and comply with all local operational procedures and policies. So I think you can see from what we've presented so far that, all these standards could really be fulfilled through preceptorship. And then we have the standards for continuing professional development. And I pulled out 3 of the 5 standards there. So, of course, all registrants need to be engaging in CPD throughout their career, but especially when starting a new role. And preceptorship could be a great support in helping registrants know what's expected of them in this new role, and also identify any gaps in knowledge or awareness and how to go about bridging those gaps. So, thinking specifically about the principles, here they are, and they can be used to develop new preceptorship programs. They could support the development of existing preceptorship programs, and they could be used to ask for preceptorship at key transition moments in a registrant's career if they feel that's lacking. Again, we know that transitions like joining the UK workforce as a new registrant, working in the UK for the first time, or returning after a lengthy period away from the workforce can be really challenging for individuals. So a well-resourced and tailored preceptorship programme can offer support for registrants at these moments, and they can be done in a way that meets their individual circumstances. So just to recap the principles, Principle 1 is around organisational culture and preceptorship. 2 is around quality and oversight of preceptorship, and then 3 is around preceptee empowerment. Principle 4, the preceptor role, so the role of the preceptor. And finally, guidance around delivering preceptorship programs. So these principles were originally developed collaboratively. We worked with professional bodies and with individual registrants. We engaged also with education and training authorities across the UK's 4 nations to make sure that they fit with existing and developing preceptorship arrangements in each nation. The QR code will take you to the web page and the full details of the principles for preceptorship. They were covered in more depth in a previous companion session to this one delivered by our colleague Florence back in January this year, and a link to this recording will be in your follow-up email. And the QR code will take you to the document. So to summarise some thoughts about how these principles can positively impact on international registrants. So for those who come to work in the UK via our international route, preceptorship can provide a way to support acculturation to both registrants' new working environment and also just generally to living in the UK. It can also help them in meeting their regulatory obligations, which may be very different to regulatory obligations in in the country where they trained or qualified. And preceptorship programs for internationally recruited registrants, either offered specifically to them or as participants or part of the general program, we feel can assist in understanding important cultural differences. So, for instance, on how the UK's health and care systems operate, and also to think about any communication expectations that service users may have compared to those of their home countries. So I feel this is a good point to introduce our guest for this webinar, Mobolaji Lewis, who is Chief Allied Health Professional for Essex Partnership University NHS Foundation Trust. And I'm just going to come out of the slideshow at this point. So I'm just going to stop sharing now and should be both on the screen. Here we are. Great to see you, Mobolaji. Thank you for joining us today.
Hi, Iain. Good afternoon, everyone. Thanks for the invite here today.
Oh, no, you're very welcome. It's great to have you here. I thought, first of all, Mobolaji, it'd be really nice to hear a bit about your own career journey, why you became a health and care professional yourself, and also some thoughts about, did you have preceptorship when you started? What did preceptorship look like to you? So it'd be really great to hear about that.
Right, that's fine. Thanks, Iain. Yeah, I'm originally from Nigeria. I trained as a physiotherapist in Nigeria, and then relocated many years ago. Initially as a student into the UK, and then joined the NHS following my studies as a Band 6 physiotherapist. At the time, obviously as an international recruit, but there was no particular process or procedure in place to support preceptorship. So it was a very tough challenge, adjusting very quickly, because as soon as you start the role, you expected to hit the road running with the expectation of the job role. So I had to make serious adjustments into the role. The benefit for me, or the advantage I had, was I was already in the country and been doing some bit of work with the NHS was as a student in a healthcare role, so I had a little bit of insight into some expectations within the NHS, so that helped me a bit. But it would have been different if I hadn't had that bit of a background. But in terms of the new role as a qualified HCPC registered professional, there was no preceptorship support in there. All I had was that period of a probation and support from my manager and my team at the time. And that was many years ago. So having been in the NHS for quite a number of years and risen up through the ranks, and now in my current role, part of what I was looking at is to ensure that my experience is actually influences what others can gain and what support we could put in place. And so when I came into the role as the chief allied health professional, I had conversation with my team on how well we could support people better. But prior to coming into this role, I also had the privilege of leading as the AHP International Recruitment Lead for my trust. And that was at the point where those changes were made and foundation laid for that. So we recruited quite a number of international recruits at the time, and so we did have pastoral care in place, because learning from my own experience, there was none when I joined. But this time, which was part of the reasons I was interested in the role, and unfortunately got the role as well. That was what I brought into the role, to ensure that we influenced that and ensure that the pastoral care was robust enough to support some newly recruited internationally trained staff, and that really went well. We were there as soon as they arrived in the country. We had teams chat with them before arrival. We were there at the point of arrival, and also at the point of getting them into the accommodation. and also when they start with their teams as well. And so we then apart from pastoral care, which actually covers a lot of personal needs and also some bit of professional needs, but not a lot in professional. But when it comes the teams they work with or the services they work with now provide that professional support. But we then actually then put in the preceptorship as well to work concurrently with the probation process as well, because probation process isn't enough about having preceptorship in place to support the new staff, give them more opportunity to learn and also have that opportunity to network with colleagues as well, and be able to have that forum where they would have a preceptor assigned to them, where they will have a lot more support both from a professional specific point of view, because we do have workbooks for each of the preceptees. If you're a physiotherapist, if you're an occupational therapist or a dietitian, there are workbooks specifically for each of those professions that some people will walk through. So whilst they're having their probation, they're also having the preceptorship to support that. And so that was what we've had in place. So yeah, so as an internationally educated physio myself, I had brought that lived experience in, and I think that actually made a lot of difference in helping international colleagues.
Yeah, absolutely. No, it's great to hear about that and your journey, Mobolaji. Thank you. And I understand retention is pretty good amongst your international recruits. Is that right? And I wondered what part do you think the preceptorship played in that?
Yeah, I believe the preceptorship has played a significant role in that. Soon as we recruited the staff and they settled in, we did put a workshop in place to meet with them, because I still believe there must be some challenges that we might not have oversight of that they could tell us themselves. So that workshop actually gave them an opportunity to express themselves and tell us, tell the senior leadership what they were struggling with. And so we took notes from there, and then took that a bit further to then look at what other support they would require. And from that workshop, we realized that there was some bit about cultural awareness that was still lacking, because having relocated from different countries, different systems and all that. So there were a lot of differences that were made known to us, that they still struggled with, which we also then look at. So we then put in place a cultural awareness training for both the internationally recruited staff and also for some of our managers as well, to support the recruits. And that has actually helped them. And so in terms of the retention, staff felt they were being valued. And that's quite key, and also have that sense of belonging to an organization, because obviously they felt they were being listened to. And as a result of that, they are already, now 2 years down the line, we recruited about just less than 30 international recruits, and we've still retained quite a significant number of them. Out of about that 30, we still have about 26 with us. And that's across the professions. We have physiotherapists, we have speech and language therapists, we have a lot of them are occupational therapists by profession, and then also we have podiatrists as well. So the feedback has been largely positive in terms of the support that has been in place for the staff, and they are thriving.
That's great. That's great to hear. And is it inclusive leadership training? Is that the name of the training where you look at cultural bias?
Yeah, it is inclusive leadership, but it has a bigger element of cultural intelligence built into it.
Yeah.
So
And
we've actually had a session with our managers, and in the next in the next 2 weeks we'll have a session for the internationally recruited staff as well coming up.
okay, so it was leaders, managers first, and then you can do the same training for the registrants. Yeah, great. And do you see that as something you're going to continue with? Do you think? I know it's early days, but it sounds like it's been well received.
It was very well received by the managers because it gave a lot of insights to the managers in terms of the things they were not aware of, or and it really challenged their thought processes as well in terms of how they come across and also how they lead staff. And so so that was very well received, and the feedback has been very positive around that. So I'm looking forward to the next session, which will now be delivered to the registrants directly as well, and I believe that's also going to go. I'm sure that will be another good session in itself as well, because a lot of work has been put into that. Going forward, we aim to continue that. Obviously, there must be some funding to support that. So that's the financial pressures that we're in right now, but we will see what we can do to enable that. But we basically want to ensure that we are able to retain staff and empower the staff, and also enable some career development as well.
Yeah, so important. Thank you. And I imagine, as you say, you'll have the feedback, the responses from the session of the managers and then the registrants, and from that, I imagine maybe some other action points may come from that, which might lead to other initiatives.
Absolutely.
Yeah, do you feel that? I mean, it's probably too early to say what they are, but do you think that?
Yeah.
Do you anticipate that?
We are a listening organization, and our leadership, of which I lead the highlighted professions, we do listen and take notes from what some colleagues say to us. The feedback would influence the direction we take as well. But the goal is supporting staff, valuing staff, and empowering staff. And on that, any feedback that we get from staff, whether manager or registrants within our employment, we will take that on board and look at how we can implement things to enable staff become a better person.
Yeah. Sounds good. Thank you. Thanks, Mobolaji. Well, it's been really great to hear from you today, and thank you for joining us again. Great to hear, your personal story as well, and what led you to become a healthcare professional yourself as a physiotherapist, and then the different roles you've had. You've been instrumental in your role in recruiting international staff, and now in your role, as you say, you're really building on that, aren't you? And looking at how you can retain staff and support them. And as we've seen, and sharing in this session, things around retention and support, and just how important that is. So I just want to say thank you again for joining us.
Thanks so much, Iain, and thank you to all. Yeah.
Thank you. Okay. So I'll go back into my presentation. Let me just do that, and we'll just continue with the final part of the session. So I feel like this leads on very nicely from the conversation with Mobolaji, because we're now going to be looking at supporting retaining international registrants. I wanted to share with you some of the work we're doing at the HCPC. We have a program, a session called Joining the UK Workforce, that we have run as webinars and as in-person workshops as well, designed for international registrants, usually those who've recently registered with the HCPC. And we do this to support the transition to UK practice, and in the session we consider some of the ethical issues that registrants may come across in practice or may have encountered already. It's also a really good opportunity for registrants to reflect on their practice and explore their regulatory obligations, the barriers to meeting the standards. And for example, we may look at a topic like raising concerns. We'll look at what the standards say, what are the barriers and enabling factors to raising concerns. So it's also an opportunity to reflect on the cultural differences of working in UK healthcare. It's run by the Professional Liaison service, and these sessions can be offered as in-person workshops to any organisation that employs international registrants. The picture on the screen there is from one of our in-person sessions. That was in Birmingham. And just to say that the session isn't limited to international registrants who are newly qualified. We really welcome attendance from those that have been working in the UK for some time and really drawing on that experience of registrants. And this session could work well as part of an existing preceptorship program that you have, so it could deliver as part of an existing program, or it could be one that you're looking to develop, or it could be a standalone session as well. So if you are interested in those, you can get in touch with the professional liaison service, and the email is on the slide there. I wanted to share some findings from other areas, really, initiatives that support and build on the work and research into cultural bias and cultural competence, which we started to touch on there in the conversation with Mobolaji, I think. Healthcare research data and learning from other regulators suggests that there is an overrepresentation of Black and minority ethnic NHS staff in disciplinary hearings, grievances or investigations, more so for doctors and nurses. At least that's what the data is showing, perhaps at the moment. And for example, there's more kind of research on that area because of that. So for example, the head of strategic delivery and national engagement for Outreach England of the GMC, Tista Chakravarti Gannon, highlights concerns around this, including international medical graduates, that they've represented a disproportionately high percentage of the fitness to practice concerns raised to the GMC by employers. Quality of registrants isn't the issue, it's deficits in the system, and that these deficits can include things like, as we've seen, lack of induction, lack of early supportive feedback, isolation, and individuals being treated as outsiders. So this emphasises that it can be a system issue, not necessarily an issue of personnel. And there are ideas from the GMC's approach to this that may be useful and applicable when thinking about how you support your international registrants, HCPC registrants. QR code on the screen will take you to a feature from our Employers Insights newsletter, which describes the impact of the workshop run by GMC, supporting a multicultural workforce. So the workshop received a lot of really positive feedback from attendees, many of whom were international medical graduates themselves. And then on the next slide, I wanted to share with you a bit of an overview of the Cultural Ambassador role, which was originally developed by Royal College of Nursing West Midlands in response to the overrepresentation of Black and minority ethnic staff in relation to grievances, investigations and disciplinary hearings. So they had a pilot project, and that led to the creation of roles and the Cultural Ambassador programme, which is designed to support organisations to improve equity, diversity and inclusion by improving the experience of staff who are involved in formal and informal processes, try and reduce the imbalance in severity of disciplinary actions taken against minoritized staff members, and also improving the recruitment and retention of diverse staff members in higher positions. So after 10 years of partnering with organisations, there are now more than 40 organisations that employ cultural ambassadors, over 500 in total, and the links on the slide there will take you to more information from the NMC about that. Also wanted to share some research that broadly relates to these themes around cultural competence and cultural bias. Back in 2014, the Snowy White Peaks of the NHS was by Roger Klein, which was an influential report that highlighted the discrimination that many Black and minority ethnic staff in the NHS encounter. And there were several subsequent related follow-up papers that are well worth a look as well. And then No More Tick Boxes, which was a review of the evidence on how to make recruitment and career progression fairer. NHS East of England. And then just last year, Unreciprocated Care, Why Internationally Educated Nursing Staff Are Leaving the UK. So this is from the RCN. And it highlighted findings from an RCN survey of over 3,000 international nursing staff and insights from interviews as well. And 42% of internationally educated nursing staff who were surveyed said that they tend to leave the UK. 42%. So It explores the challenges faced by internationally educated nursing staff, including racism and discrimination in the workplace that are influencing people's decision to leave their nursing careers in the UK. And this was quite recent. This came out earlier this year, Listening and Learning, Amplifying the Voices of Overseas Trained Workers from the National Guardian's Office. And it contains recommendations to enable improvements in the ability of overseas trained workers to speak up and raise concerns. It also highlights the need for retaining staff and contains examples of good practice in the light of a decrease in international recruitment and an increase in overseas trained workers leaving the register. Raising concerns, speaking up are included in the HCPC's Joining the UK Workforce session, and we also offer sessions on raising concerns, which reference the standards for raising concerns. So in summary of this section, I offer a quote from the National Guardian's Office paper, from this paper, which says, addressing these concerns and ensuring overseas trained workers feel safe, valued and supported remains crucial for maintaining a sustainable NHS workforce. NHS England have published a range of useful materials around supporting international recruitments. They've identified many barriers facing international recruits. Include adapting to NHS work practices, technical language, equipment, abbreviations, establishing a home in a new country. Themes that we've seen, and I think the examples we showed earlier and the things Mobolaji talked about as well are helping to address these types of things. Various recommendations around onboarding, pastoral support, local cultural and support requirements of staff. And also signposting international recruits to relevant professional support networks. And again, the QR code will take you to their webpage for more information if you find that useful. So we're coming towards the end of the session today, and I just wanted to give a bit of a summary overview of the things we've looked at. I hope we've shared some perhaps light bulb moments with you today. I hope ideas that you can take away, or perhaps affirmation about the work you're already doing. And in summary, this session, we began by thinking about the contribution of international registrants to UK healthcare. So we talked about the challenges they've faced with reference to the experiences of doctors and nurses within the NHS. We looked at the HCPC data as well, that reveals that international registrants are a significant part of HCPC registration. We considered the experiences of international medical graduates, the challenges they have faced or continue to face, including discrimination and a disproportionate referral rate for fitness to practice. We reflected on how the current outlook for international recruitment is changing, a decrease in international recruitment and an increase in overseas trained workers leaving the register. We saw examples of good practice from 2 NHS organisations and how they've approached the recruitment, support and retention of international registrants. And we had a bit of a refreshed look at the principles of preceptorship, how they can complement programmes of recruitment and support. We heard from Mobolaji Lewis and how I thought was a really insightful conversation, and I think it perhaps gets us to think about and recognise how the voices of lived experience are crucial to understanding and improving the experience of international healthcare professionals working in the UK, and listening to their experiences and building on that really to help support and retain them. And we had an overview of the HCPC education programmes that support international registrants, and specifically a bit of an overview of the Joining the UK Workforce programme. And we looked at some examples of how organisations and professional bodies are supporting international registrants by addressing cultural bias, cultural competency in UK healthcare. And we highlighted some key research and reports in this field. So I really hope today's session has been useful, perhaps thought-provoking. You may be in different stages regarding preceptorship and international recruitment. So wherever you are at as managers, as employers, I hope you found some useful takeaways from today. And please do get in touch if you have further questions, or if you would like to find out more about the programmes of work that the professional liaison team can offer, such as the Joining the UK Workforce programme. And we really look forward to working with you. And on that theme, staying connected, here are some ways to stay connected with us. You can contact the professional liaison team via our email address. A reminder of our student hub, there's lots of really useful resources there for those who are in training. And we have a presence on the major social media sites. Our YouTube channel in particular, I think, is a really great resource, including past recordings of our webinars. And we would really appreciate it, finally, if you could complete our evaluation form. And thank you very much for listening today. Perhaps Patrick in the background could post this in the chat as well. And just so, yeah, thank you very much for coming and joining today, giving up your time. And thanks again to our guest, Mobolaji, and to Patrick and Becky, our team behind the scenes today, helping things go smoothly. And once again, thank you to all of you for joining us. So have a really nice rest of the day. Thank you very much.